subtalar neutral test we're going to do is have the patient lying prone, and we're going to take their uninvolved leg and go relax and move it into a figure 4 position with their ankle crossing about their knee. The next thing we're going to make sure is that the involved leg of the patient, or the leg we're testing, isn't in internal or external rotation. We want it to be straight and neutral. And the next thing we're going to do is make sure to put the patient into subtalar neutral. To do this, we're going to grab both sides of the talus, on the medial and lateral portions of the talus, and we're going to internally, or we're going to move the foot medially and laterally until we can feel the talus evenly. And then from here, what we're going to do is slightly dorsiflex the patient. And so now they're in subtalar neutral. We're going to hold them in dorsiflexion just with our thigh. Now, to measure the angle, the subtalar neutral position is used to measure the angle of calcaneal varus or calcaneal adductus. And what you want to do is draw a line along the patient's midline of the patient's lower limb following the tibia, and also draw a small line with the patient's permission along their calcaneus. You would not want to draw the line on the Achilles tendon because it has a tendency to roll either medially or laterally when you're getting them into this position. Now, once you have your lines drawn, you want to compare the angles. So for this patient, since it would be normal, she has a few degrees of calcaneal varus or adductus. Typical is about 4 degrees, but anything between 2 to 8 is considered normal and functional. So this test would be positive if the amount of calcaneal varus were less than 2 degrees or more than